dietetic support provider at Kim's Cancer Hospital over in Kent, and I'm also on the clinical advisory committee at Percy Health, which I'll talk about a little bit more in a moment, where we are working on a project for an Innovate UK grant. I also run regular webinars for Breast Cancer Now, and a little bit more about me at the bottom for anyone who wants to know. Fun fact, I used to be an accountant before I was a dietitian. So I'll just start off by talking a little bit about Percy Health, which is an organisation I'm really proud to be a part of. Percy Health is the UK's largest and broadest network of oncology healthcare experts, and it's dedicated to providing connected, specialist support throughout the whole cancer journey, from diagnosis to recovery and beyond. And we've got over 20 different specialisms, from dietitians, physiotherapists, speech and language therapists, we've got psychologists, menopause support, lymphedema, and hair and image advisors, plus others. And really the point of Percy Health is that we're trying to bridge the gap between what's available on the NHS and making sure that people's unmet needs are being supported. So in terms of what a really interesting project that I've been involved in with both Percy Health as well as Field Doctor, so a meal provider. And we've been awarded this grant to develop a range of meals tailored specifically for the breast cancer patient. We're focusing on survivors for this project, addressing their unique nutritional needs. So the development process for this was really thorough and evidence-based, and we used the research findings from the Live Cancer Research Fund, as well as a review of the literature since those reports have been published. So the meals that are being designed are focusing on the specific needs of breast cancer patients. So we're looking at bone health, at vasomotor symptom support, at weight management, vitamin D status, as well as hopefully improving fatigue symptoms as well. We're going to be giving them the participants, we've got nearly 100, they're just about to start in the study. We've got they're going to be given a 12-week meal plan with these meals, as well as an educational programme. And I think that's where we're really excited with this educational programme of care. A lot of the research shows us that the more that we can educate patients, the better their outcomes are for survival. So maybe this time next year I'll be talking about the results from our project, but for now I'm just going to talk about the research that has taken place for part of this project. So I just want to start off by saying that the trends in diet and cancer research, and these infographics were published paper last year, and obviously breast cancer publications are right up there behind colorectal cancer, and we know that research has skyrocketed since the mid-80s and 90s. Articles with the term high fat were the most prevalent, particularly focused with breast cancer as well as some of the other key cancer types. And from sort of 2010 onwards, there was a steady increase in publications looking at healthy eating, ketogenic diet, Western style diet in relation to cancer. And as we know that cancer, including breast cancer, is associated with obesity, and global obesity rates continue to rise, it is expected that research on cancer and caloric restriction and fasting in cancer is also going to grow. We know that weight gain is common after a breast cancer diagnosis, and although there is a trend in the amount of weight gained which is coming down, we know that a significant proportion of women will still gain weight during treatment, whether it is during the actual treatment or the months or years following treatment, and it's thought that this is over 50%, sometimes depending on the area, the rates can be significantly higher. So it just highlights the importance of thinking about post-diagnosis weight gain and tailored lifestyle interventions for the patients. That include behavioural strategies as well. I also think that there is going to be an increasing trend on looking at publications involving ultra-processed foods in cancer research. And there was a study looking at within the UK Biobank, looking at the link between UPFs consumption and cancer risk over a 10-year period. The key findings were that UPFs can make up to 40% of some someone's total diet, which can be up to 70% of someone's caloric intake. So the average is 50%, but basically this is telling us that whilst there are some huge limitations in the UPF classification system, the no food classification system, it's something that practitioners should be thinking about when we're thinking about dietary advice to patients. And I will say out there right now, I'm not against bread. There's nothing wrong with supermarket bread, but there are going to be some key things that we're going to be encouraging people to make some swaps for in their lifestyle. I'm not going into the World Cancer Research Fund recommendations, but I will just highlight here from this 2018 report that we know that physical activity is important, we know that being a healthy body weight is important, and we know that a fibre-rich diet, which also includes soy, is linked to better overall survival following diagnosis. So it's really thinking about holistically and how we can support the patient through all of those avenues. When we're thinking about supporting the patient, it's less about individual dietary components where we may have limited or inconclusive evidence, and it's more about dietary patterns. So each of these dietary patterns has got evidence to support that they've all got similarities, but they also can be really helpful in reducing cancer risk and improving outcomes. The one diet that stands out probably more than the others in terms of global research is the Mediterranean diet, which I will just briefly talk about a little bit more here. We know that there is a strong association with the Mediterranean diet in terms of cancer incidence as well as overall survival, and adhering to the Mediterranean diet can lower risk of all-cause mortality, which is something that we will be thinking about talking about with our patients. So what are the key components then? It's really not that complicated. It comes down to including lots of different fruits and vegetables, whole grains, healthy fats, lean proteins, legumes, nuts, seeds, herbs, spices, and olive oil. Less processed foods, more whole foods is the summary here. But the benefits, Mediterranean diet benefits also have additional advantages outside of the cancer settings in that they are cardiovascular protective. And when you think that there's a huge amount of cardiovascular disease in our patients, our breast cancer patients, it's obviously makes sense then that we're going to be thinking about the Mediterranean diet and its benefits. It's also got these anti-inflammatory benefits, which we know are associated with reductions in cancer-related fatigue as well. So I just want to talk about dietitians then and the key role that dietitians play in supporting cancer patients through their treatment journey. Ideally, gold standard should be that every patient should have access to a dietitian, whether it is in a one-on-one setting or within a group education setting. For anyone working with private patients, it's very simple with their private medical insurance to refer to a dietitian. They should be able to get some sessions covered with a dietitian under their policy. And for NHS patients where the support may be more difficult, I would probably encourage breast cancer charities. They do loads of wonderful group education sessions, which we know can be really, really effective. Breast cancer patients then, they think about lots of different things, and a diagnosis can really make people think about changing their lifestyle, their eating habits, basically they're going to be driven by fear, and they're going to be, first of all, asking their surgeons, their oncologists, what can I do? What am I supposed to be eating? What am I not supposed to be eating? And it can be really, really tempting as oncologists or other healthcare professionals to give nutrition advice. And it does seem really simple. Mediterranean style diet is what you need to have. But actually we know that there is an increasing rise in orthorexia, in disordered eating, particularly among the breast cancer patients, because they're driven by this fear to have a really healthy diet. And I'm meeting some patients, and I kid you not, who have excluded dairy, they've excluded soy, they've excluded this, and this, and sometimes they're left with maybe 5 or 6 different foods. So whilst it can be really simple to say to somebody, don't have any sugar, what that then means behind the scenes when they've left your office is that they are going to be taking out loads of natural sources of sugar that actually contain all these lovely polyphenols and these other things that we know are beneficial to them. And when they finally get to see someone like me in a clinic, we've actually got options. So that's where obviously referring to a dietitian is really important here. Dietitian's role is essentially to translate the science into easy to understand information with practical tips and strategies of how they can actually live day to day, living with or after cancer. Whilst I'm not going to go into all of these topics today in great detail, because that's what I need to know about, you don't need to know about it, ideally you should just be referring. What I would like to say is that sugar, fine, in moderation. Preferably from natural sources. We don't need to cut all sugar out of our diet. Soy, safe, beneficial. Dairy, safe, beneficial. Ketogenic diet, fasting, probably not, but maybe for some people. Alkaline diet, absolutely based on bad science, let's not go there. Supplements, very, very personalised. It should be according to the individual, and obviously we have to think about interactions and safety. Vegan diet, if someone wants to. It's not necessary to. It can be harder to get some key nutrients. Carnivore diet, probably not. We've got lots of evidence to say that plants are beneficial. We've got lots of evidence to say that meat can be beneficial too, preferably just not processed. So we support patients in helping to really reassure them about some of those hot topics that they ask us about, but we also support patients in lots of other ways as well. Because during treatment, loads and loads of breast cancer patients experience really unpleasant side effects, and they're going to struggle with what to eat. And if they've already got fear around food, then it's going to complicate things even further. We also obviously want to support our patients pre-operatively, post-operatively, and then obviously in the longer term, we want to be reducing their risk of not only recurrence, but also things like osteoporosis. We want to help them with cardiovascular disease prevention. And also anxiety and depression, which are really, really common concerns with a breast cancer patient following a diagnosis. We also know that there is substantial evidence that diet can play a role in positively influencing our mental health. So I've kept this really, really quite short today, because I think it's probably helpful in terms of catching up on time. But if you'd like to use my clinic, then here's a quick overview of what my team can help with. What I probably would say is that our support as a nutrition professional doesn't stop after the treatment stops, and actually we support patients through every stage, right up until palliative stage, helping patients and their families understand what to expect at that later stage as nutrition declines and the body starts to fail. So that brings me to the pivotal role of the dietitian, and I'm happy to answer any specific questions on diet that anybody has. That was really short, wasn't it?
That's really helpful there, Jo. Thank you. And you dispelled some of those myths as well. That's so interesting.
I was told 15 minutes originally, so that's why it was quite short.
Yeah, you did well. Thank you so much. Right, if you want to take a seat there for the panel.